Hello, everyone. This is Mark Anthony with AI Edge Podcast, the place where we bring you the best of the best doctors in their niche, in their area. Today, we have a special guest, Dr. Manish. We're going to be talking about Shockwave, guys. Shockwave, you're probably wondering, what is Shockwave? Is that a video game? No, it's not. Shockwave is something that Dr. Manish has been helping people with, hundreds of people. We're going to be talking about how this has helped his practice, and we're going to learn a little bit about what Dr. Manish does. And you can also find Dr. Manish at Princeton Chiropractic and Disc.com. Princeton Chiropractic and disc.com. So today we're going to be talking about how Shockwave has helped the growth in his business and what it's doing right now currently to change people's lives. Thank you so much, Dr. Manish, for being here. We appreciate it.
You're welcome. Thanks, Mark.
Thank you. Tell us your story before we get into Shockwave, because it's going to shock some people, and how you got into doing what you do and why you're doing what.
Right. Again, this is a question a lot of people have asked me over the years, and it took me a while to understand why I do what I do. Most everybody had a story why they became a chiropractor. They were either treated by a chiropractor because they went through something when they were younger, chiropractor helped them, or they had an aunt or an uncle or a family member who was a chiropractor, and that's inspired them to be a chiropractor. Me, I just want to be a doctor. That's all I wanted to be. And, coming from a family background, being an Indian, growing up partly in India, expectation were that you're going to be a doctor or an engineer, right? And I'm like, well, I'm not really too keen in math, so let's look at science. So, so I just knew I was going to be a doctor. I just didn't know what. And all I knew at the time was, being in school, medical doctors. And for some reason, I just wasn't, I just was afraid or not really drawn towards medicine. And I'm like, well, what else can I look at? So then I started pursuing dentistry. A lot of people say dentists are not real doctors, right? But to me, the degree says a doctor. So let's look at dentistry. And
Exactly.
I pursued that. And fate had it that everything was good, and I was I was on the F score of the dental entrance exam at the time was about 16 or 17, and I was 1 point short on the entrance exam, and that kind of kept me from getting an admission, even though my GPAs and everything else was lining up. And so somebody else threw me out, option for me, like, be a chiropractor. You played college sport, you coach tennis, and you love playing, working with athletes. I'm like, sure, yeah. Look at chiropractic. So I looked at chiropractic. I'm like, I like the fact that they work with athletes, and that's how I ended up in chiropractic school. So I would say the fate, it was destiny for me. Because to make a long story short, is I didn't really quite understood what chiropractic was for many years, even in the time I became a chiropractor. With 2014 was a transformation, for me. It changed my life completely. 2012 is when 2008 is when I became a chiropractor. And I've been in practice since 2008. And in 2014, I woke up one morning, which is I can't never forget, but it was a Saturday morning. I woke up, and I went to the bathroom, showed to the sink to wash my hand, and my whole left leg just goes numb from all the way from my lower, lower back. So there's just sharp shooting, stabbing, burning, whatever pain you want to call it. It was everything there. And it was the worst pain I ever had in my entire life. And I couldn't figure out why that happened. Friday night, I was great. Saturday morning, reaching over, and there goes. So I knew the symptomatically, I knew what was wrong. I knew that my disc has gone out, but I just couldn't understand why. I didn't do anything. I just woke up with it, right? Going to the bathroom and just reaching over.
Weird.
And that took me good about 9 months to be out of pain.
Wow.
No chiropractors can put a finger on my lower back because it was so painful to doing any type of adjustments. I was treating myself in my office, seeing colleagues as well. And I was treating myself 5 days a week on a spinal decompression that I had in my office. And I almost threw the towel in, because I'm like, it's not getting better. I probably would need to have a surgery. But again, I believed in chiropractic because I treated patients that were half as bad as I was. So that, the belief, or trust in higher power, which you want to call it God or whatever call it, I knew the body can heal itself.
Exactly.
As much as I wanted to be healed in 3 months, that wasn't going to be the case in my scenario. So I kept treating myself, and 9 months later, I was pain free finally. And it took me 2 years before I was able to go back to doing basic running,
Wow.
stuff like that. So it was a long road to recovery. And as I looked back, I did have a car accident in 2002, undergrad, where I was T-boned, much younger. And I had some back issues back then. I had some, hairline fracture in my pelvic area, and I was treated by traditional medical model and some chiropractic adjustments back then, but had really no other issues ever since. And that issue just kept getting worse, probably. And maybe that flared up somehow. And all I knew that that's the only thing I can think of that could have led
Wow.
to what I experienced. And that really gave me a good understanding of how the body heals, what it takes for the body to heal, but more so what chiropractic really is. Because up until that point, I treated chiropractic as just neck and back pain and more so pain management, and that changed, how I understood chiropractic and how I treat patients from that point on. So, fate wanted, my destiny to be a chiropractor to help myself. Because that was, if I hadn't been a chiropractor, I probably wouldn't have, yeah, I probably would have had a back surgery, at the age of 32.
Wow. It's amazing. A lot of people don't realize that you could have had an injury in even high school or when you were younger, and it may not show up now, but it can show up later. If that's why I love chiropractors, and I believe that everybody should be getting adjusted. I'm
Right,
not a doctor, but I always say at least twice a month. It's kind of like, if you just ignored your vehicle on its engine light,
right,
eventually the engine light will just stay on and until you fix the problem. But what people don't realize is that the more you prolong the situation and not get to the root of it, it's going to come back and haunt you. Kind of like with you. You thought you were fine, hey, but a car accident's not something to sneeze at, especially
right. And this is what we see. Like, say, it took me a while to understand that, right? As early on, being a new chiropractor, it that understanding wasn't there, and going through that basically helped me understand how the body functions at a level that wasn't, in my understanding of getting the education through the school. Just pure for the fact that school doesn't teach you everything. They'll help you, get the degree, but
yeah.
there are things you have to learn on your own.
No, 100%. What would you say to people out there? Some of the things that the signs that you saw maybe during the years, like were there like maybe a little bit of numbness once in a while, then it would disappear, or was there a
Yeah.
little pain?
So
How did that happen?
right. So again, I was an athlete. I played college tennis, high school tennis competitively, as well, and I coached tennis for 12 years as well. So I was physically fit. I worked out, lifted weights 5, 6 days a week. I was in really good, solid shape,
Wow.
and so obviously my body being, physically fit. The car accident, where my car was total. I was T-boned, hit right at the driver's side. It was a pretty bad car accident, but again, just being young, being physically fit, the symptoms weren't as bad at that moment. And I recovered faster because I was younger, because as we're younger, body tends to respond quicker. But what symptoms I had along the way, as you mentioned, right, which again, I quite didn't understood, but I would have some flare-ups in between, every now and then out of the blue where, I'd feel some achiness or, I would feel some pain down my leg. But then I'm like, maybe, I just overworked. Maybe I lifted something wrong. Let's just stretch it out. Let's just put some ice on. Let's just give some break. And yeah, I felt better. So didn't really think of it too much. And there was even a point where once, I couldn't get out of the bed for, a
Wow.
day. It was just super hard to even sit. But again, I rested, put some ice on, and it went away. So I was getting some signs, but again, it didn't make sense to me at the point until that big, flare up that happened where I'm like, okay, now I know why those things were happening.
Wow.
So I had
Okay.
signs along the way. I just wasn't putting it together and I was ignoring them, or I just didn't know what was happening.
That makes a lot of sense. It's funny you brought up tennis. I used to teach professionally over at Pebble Beach up in California, and I played a lot of advanced tennis also. And I tell you what, I started playing pickleball. You ever played that
Yeah.
game?
I have not, no, I know they call it pickleball now, but back when I played, there was such thing called paddle tennis. I almost feel like
Yeah.
paddle tennis and pickle is pretty much the same thing.
It's different. It's if I could explain it, it's like ping pong on steroids.
Okay,
Just, and with our swing, we got to shorten the swing.
that's true.
It's and there's a lot more movement, man. Your feet get
Yeah.
like legs get like jello, but it's
Well, one of these days, I'll give it a shot. I'm not sure how they'll work out, but that's probably the reason why I never got better at the racket sport, that you play. What is it called? At the gym, little.
yeah. I know. I never played that. I didn't like that game. It was too.
Yeah,
It was too
you're trying to
fast.
keep them too fast, or more so, that the purpose of that, you're trying to keep the racquetball, the ball as low as possible.
I know.
Kind of trying to keep the ball up at a certain height, right?
No, I mean that sucker's like a bullet, man. I mean, I'm good, and you got to use your wrist, so it's very different than tennis. We use our arm,
Exactly.
So, but on another note, let's talk about Shockwave. Maybe tell us a little bit about how it's not just helped your practice, but it's also like helped a lot of people. And how long have you been using Shockwave?
Right. So again, what I went through with my own injuries, what led me down the path of what I do now,
Wow.
right? Because it took me 9 months to be out of pain, and it took me 2 years to be able to do some basic movements. Now, realize, I was an athlete, I was physically fit, so not able to do a lot of the physical activities wasn't, it was really taking a toll on me, mentally. And I mean, there's time like I couldn't see my outlook on my life wasn't that great. It
Wow.
may not show, on my face, but internally I knew what I was feeling. I just wanted to be strong, on the outside. So decompression was one thing that really was, I would say, the only thing that really helped my back. As I love chiropractic, but at that point, adjustments, I couldn't tolerate the adjustments. Even chiropractors, weren't willing to adjust me in the because they think they may make it worse. So after I recovered from it, I was on the lookout. I had to do a lot of research and a lot of learning on my own. What is it out there, that I can, that can help me expedite
Right.
healing process. And that's when I initially came across cold laser. Right, red light, cold laser is kind of big deal right now, right?
It is.
Back in 2012, nobody even knew what lasers were. 2014, nobody knew what lasers were, and I got introduced to that back then. So that, I started incorporating that as well in my healing process. And yes, it was helping patients. We had amazing results then. But again, we get these cases where patients were very, chronic, in a lot of pain, and sometimes people wanted to see a quick response. And, when the condition's been pretty severe, chronic inflammation, it takes a while for to see a good response. So again, I kept researching, and when I saw my practice to move in Illinois, to move back to New Jersey, that's where I'm from. I came to New Jersey, and like I had the time when I was waiting to start my practice in New Jersey, and this was beginning of COVID, and I was waiting for my license as well to come through. So I'm like, what else is out there? I have these severe cases coming in where, for lower back issues, disc issues. And I see a lot of patients with the disc issues in my practice where they've had, failed back surgery. They've had, multiple disc herniation, spinal stenosis, constant numbness, tingling. They've done injections, cortisones, physical therapies, all sort of stuff, even chiropractic. And, they're basically looking at surgery, or they're just don't want to go to the surgeon, just don't know what else to do out there. So they end up in my office because of decompression. And yes, we're able to help them, but I'm like, there's got to be something else out there that might also help expedite the healing process. And my research somehow led me to Shockwave. And, it was just, again, like I believe in destiny or higher power. What you put out there,
Oh
somehow
yeah.
universe will get back to you, right? So, that's how I came across Shockwave, and I went down the rabbit hole of Shockwave, and Softwave was, the one that popped up in my feed on my search. But then there's like a different types of shockwave, and as I went in more and more research, really the true shockwave is an electrohydraulic shockwave, and that's the Softwave. And what you see out there, most people utilizing is a mechanical pressure wave, which is an EPAT.
Right.
And which is, it's not a real shockwave. Does it work? Don't get me wrong, it does work to a degree. But now we're talking, in a medical term, let's going to compare it to something, right? You're talking a Tylenol and you're talking, a cortisone shot. They both give you a pain relief, right? But one is way stronger, one is way more quicker in response than the other, right? That's kind of the difference between an EPAD, a mechanical pressure and a true shock wave. So I've been utilizing shockwave in my practice since 2020, because that's when I started my practice in New Jersey here 5 years ago. And that's when I came across it. And I was the one of the three people in the entire state 2020 to introduce shockwave, soft wave to the state of New Jersey. And I was less than 100 people in the whole country at the time to be the early provider of a soft wave electrohydraulic shockwave into the country as well. So I've
Wow.
been doing it for a long time.
So for those of people out there that don't know what Shockwave does, maybe give us a little, 411 on there.
Right. So if, I'm going to kind of step back a little bit here so I can show you the machine here, right?
Sounds good.
So what it does again, I have them both, by the way. So we can see this is the EPAD. It's most commonly seen in many places. This is a mechanical pressure wave. Again, they didn't know where to categorize this particular device, so they do categorize under a shock wave. But if you're talking a real shock wave, this is not a real shock wave. This is good for any type of deep tissue muscle work. I would call this like a deep tissue massager on a steroid.
Okay.
I'd put that in like a deep tissue muscle work and a shock wave right in between. So this is good for like a tendinopathy and stuff like that. It does create a trauma to the tissue. Many times, it will leave a bruise on the skin as well. It's a tissue damage to cause healing. And so the contraindication with this is somebody who, is on a blood thinner. This is not something that you'll be using on.
Okay.
Because it may leave a bruise as well. And if they have thin blood, in vessels, it can cause more damage as well. It's also not recommended to use on a bone as well, because it's going to bruise the bone as well.
Okay.
There is an indication it works, but again, you have to understand when to use it and how to use it. And the surface area for this is basically the size of this applicator here. And as the sound comes out of this, it will pinpoint to a smaller area.
Oh, I see.
And also the sound amplitude is very low. It's like going, if you look at a waveform of this device, it's doing this big wave, right? Versus if you look at a true shock wave, this is a real shock wave. There's a water and there's electrical coil in creating a sound. That click here, that we see that one sound is shooting at 3,355 miles per hour.
Wow.
That's a supersonic sound. And that waveform is like doing this. So it's a quick, inflation and quick deflation. And that sound is basically causing a vibration at a cellular level, which is called mechanotransduction. And it is causing the brain to believe that there's an injury.
Okay.
Causing a trauma to the tissue.
Oh, so it's repairing.
Exactly. Yes. So it's acoustic, right? And it tricks the brain into believing that there is a trauma, so that your brain will activate, our body will activate our innate stem cells to cause the healing. It's also causing, go ahead. Right. Okay. So, I wouldn't necessarily say they're dead stem cells. Stem cells are not active
Damaged
all the time. Damaged, right? We have a damaged tissue. Inflammation is not a bad thing. We kind of look at inflammation as a bad thing. In the beginning, when we have an injury, we have inflammation, which is good because our body's trying to heal, whatever injury you may have. That's where the swelling happens initially. So if you sprain your ankle, you have some swelling, right? So your body is causing the swelling because it's trying to bring in healing to the environment, to that injury, so that it can heal the damaged tissue.
Right.
However, if that process continues long enough, that becomes a chronic inflammation. And at this point, our brain sees that, okay, I've done the best I can, and it shuts off the good healing.
That makes sense.
And now you have chemicals, that are causing more pain. They kind of linger on longer. And
Right.
that's what leads to more tissue damage. It leads to more chronic inflammation and pain. So what the shockwave, the real shockwave, the shockwave is doing is it's reducing that inflammatory chemical that is causing the inflammation, and it's kicking up the good chemical that is helping to heal the tissue. So when the sound hits the damaged tissue, patient will feel some discomfort. And we know that it is breaking up all the scar tissue that's deep inside, but
That's
more so,
amazing.
it is
I'm
causing
sure that
angiogenesis.
with Shockwave, you get so many people,
Angiogenesis is a
reoccurring people that you
formation of
never
new
even
blood
spoke to because
vessels.
it was referred to. Wow.
And that's how it's bringing in more
And that's when you
nutrients,
know you're
oxygen
guys
to
out
the
there. I just want to let you
tissue,
guys know in
and
internet
also bringing
land,
more
that's when
stem
you know
cells
that
to that
you are a
tissue,
good doctor.
which
When you have people that are
have been
referring.
dormant.
I've
So
never
are
in my
waking
life
up our
seen
innate
somebody refer, and I call them
stem
big box
cells,
doctors. And
endogenous
there's
stem
nothing
cells
wrong
to
with
cause
big
the
box
healing, and that's
doctors, okay?
coming to the area via the
Because,
effect of
we all
angiogenesis, which
need,
is the
if we
creating of
need
new blood
surgery, but I've
vessels.
never really seen,
So not
people,
only
hey, yeah, you
we're
got to go talk to my
healing the
doctor over
tissue,
here.
we're making more
It's rare,
healthier by
and the reason
flooding
why
it
you don't
with
hear
more
that,
nutrients,
you
oxygen,
know,
and all
is
that.
because a lot of these doctors out there will patch things up with giving you a pill and another pill and
Neuropathy,
another
yes.
one, and to
So
the
with
point
people with
then you're no longer
neuropathy, I mean,
here.
the
What I
biggest
love
cause of
about Dr. Manish is
neuropathy, I
that
mean, there are
he
various forms of
focuses on
neuropathy, right?
finding the root, not just
The
giving you a
cause of
patch.
neuropathy could be a diabetic,
So if those of you
could
that are
be
out
a
there
drug induced,
in
could
internet
be a
land that are
you
maybe
know,
driving, listening to
chemo
this,
induced,
people
or it could
travel to
be
go see
a
Dr. Manish. It doesn't
compression
matter.
of
We should
the
never let
nerve
distance
somewhere along
ever
the
bother
spine or in the
getting
extremity, the
better.
leg or the arm,
And the
whatever that
beautiful
may
part
be.
is it doesn't
But in
matter how
all
old you are.
scenarios
If in your
where the
60s and
nerves are
70s
not
and your doctor's
functional,
telling you,
the
you know
nerve
what, you're
doesn't sense
done,
anything anymore, or
don't
there's a
listen to
loss of
that. Remember,
function.
there's an old saying, what you
And that's
think is what you
happening because
become.
our
What
nerves,
you
the
put out
further away they
is what
are
comes
from
out.
the
And so I just
spine,
want to say thank you so much,
there's a
Dr.
lack of
Manish,
blood flow,
for
which is
being here
leading
with us.
to
I love
the
what you do. I'm
tissue
passionate
damage
about
and the
what you
nerve
do,
damage.
getting the word out there. I
So the
thank you for
nerves are not
serving
really,
the world
you know,
and
they're not dead.
preaching
They're
on
just,
what you do on
they're
healing
just
people as
damaged,
as as many
and
as
what the
possible, because
soft
that's what the
wave
goal is.
doing is it's creating that angiogenesis, that effect where
Yeah,
it's
please do.
helping to create that new blood vessels into the tissue, which is bringing more blood flow to that
Oh,
area
good.
of the
Let's
damaged
go
nerve.
for it.
So that the nerves are also getting more circulation, more oxygen, and more nutrients, and that's how it's healing those
Yes, I
nerves.
have.
So people with neuropathy are benefiting and helping with those symptoms of neuropathy because it's helping the increasing the blood flow to the tissue. It's also creating angiogenesis for the nerve to get more nutrients and oxygen to the
Correct.
area, helping to decrease inflammation in the tissue so that they have less pain as well. Correct. That is very true. And yeah, I'm not surprised. Like I said, 5 years of doing this since 2020, I have done
Example.
Shockwave and
Okay.
the Softwave on almost anything out there. I've
Be
patients,
another podcast.
successfully gone back to living a normal life after neuropathy, reversal. I had patients with the chronic lower back issues, 20, 30 years of lower back where they've had, simulators put into the spine, they've had cages and fusions and all sort of stuff, and they couldn't find relief, and now they're doing things that they couldn't do before in 20, 30 years. I have people with bone and bone, that they're told they would need to have replacement. They're going up and down the stairs with no issues anymore. I had patients with I went to a patient who had a prolapsed uterus, and she was referred to me by another patient, and we used the pelvic floor strengthening healing, and she was able to get a lot of relief from that. I had patients with a TMJ issues.
Wow,
I
that's
mean, you
amazing.
name
And
it, I've
oh
done it
wow.
on
Next thing you know, it's going to be
face, head,
AI
even
in
digestive
conjunction with
stuff.
what you're doing in the next future. You know how
Sorry,
everything
and
just keeps
again,
getting better.
that's where the different lies. You can't use the
Wow.
mechanical
Well, thank you
other type of
so much,
shockwaves,
doctor, for
for a
being
lot
here
of
on
the
the
other
show.
conditions out there.
Again, we love what you do. And
And
everyone, call
software
the number
allows
on
you
the
to
screen.
do a lot of these
And maybe
other
I want
things,
everybody to hear from you,
other
where you're
areas of the body,
located and where they
that
can find
because
you.
it's a low energy shockwave, but the effects are much more wider and better versus the other forms of mechanical pressure shockwave.
Awesome. Well, thank you so much. And God bless your practice, my friend.
Yes, yes, and again, the research.
Awesome. Yeah.
This is how
So
the
just,
shockwave
I'm going to
started, right? Everything
pause this
started with
sucker and we
electrohydraulic
can stay
shockwave.
on
It
it.
was initially used, and
Thank
it's
you.
still used in the medical field to break up gallstones. So they were doing research on it, and then they decided, why don't let's try this on urology for sexual health,
Wow.
and they were seeing good success with sexual dysfunction in males and females. And then they slowly did research on it, let's try on musculoskeletal issues, such
Wow.
as, spine and whatever joints and whatever not. And they start seeing that, it was, good for those condition. And so it made its way into different, disciplines. And it's been used in cardiology field as well for open heart surgery. Before they stitch up the patients, they're using it to reduce the formation of scar tissue on open heart surgery afterwards, so that there's less of the scar tissue buildup. So they even use in cardiology the same shockwave. It's just the strength of the shockwave varies because obviously different discipline requires different strength of the machine. Gosh, this is yeah, there are many, but if I had to throw one out there, I would throw it out there with patient named Kathleen Jackson.
Okay.
And I'm sure she has no issue me putting her name out there because she has been out there and attest to how this shockwave has changed her life. She was referred to me by a good colleague of mine from Philly, and she had a really bad knees, and she was young, but because of her knees, she hadn't been able to sit in a low chair for over a year. And if she's out in a social environment, she's always looking out for like a high chair because
Right.
she couldn't get out of the chair, and she was gaining a lot of weight as well. And she had seen this amazing naturopath out in Philly, and the naturopath was helping her, but obviously he couldn't help her with the knee issue in terms of the physical side. So she was referred to a colleague of mine, and she had seen him, but he couldn't help her with that. So he told her to come and see me because I had the software. So
You get the
she
power.
drove an hour, a couple times a week for a few months to see me. So she was driving an hour each way. And after about 3 months, not even full 3 months, matter of fact, after about 6 visits, she was stoked to be able to sit in this low chair and be able to get up. And she was in disbelief that she was able to do
Wow.
after over a year. And it changed her outlook in the life to the point where uh, she she could enjoy her life now. 6 months later, a year later, she started working out, exercising, and she's lost tremendous amount of weight. And she's gotten more healthier than she's ever been because she could actually move now. Of course, of course. I'll add one more to this, actually, if you don't mind. The other thing, I do is a cranial facial release. Are you familiar with that? Yeah. So you're out in California, right?
Yep.
You heard of Dr. Adam Del Torto? He's a pioneer of the procedure CFR. It's the balloon adjustment through the nose.
Wow.
And yeah, so I get patients traveling from all over for that. And I'm the only one in the entire state who does that. And there's not many of us who do that. And I can tell you that I've had patients traveling all the way from Boston, staying overnight. And these patients have, we're talking now, these patients are dealing with chronic sinus issues, chronic breathing difficulties, migraines, sleep apnea.
Wow.
What's left for them? Not much hope, right? These are the last resort people. Trigeminal neuralgia, so the suicide disease, right?
Wow.
So they can't get much help with that. And, so again, when you ask me like, what's one story, I gave you the story for a shockwave, but I got stories way better than shockwaves. So that's that, I mean,
That'll
that would be another podcast for sure. We could talk about that, So,
I
but
like
again, yes, my practice, it's different because like I said, what I went through with my own injury changed how I practice. It led me to a path, that I never imagined I would walk on, and it made me a better chiropractor, better healer, I would say, because I didn't understand the healing up until what happened to me. And chiropractic is not about moving a bone; it's about healing,
wow.
and that's what it is. And this is my adjustments are probably no different than what other chiropractors do, but it's understanding the body, how to heal the body is where I'm different. And all these modalities helps me along the way. Of course. Right? Yeah. So I'm in Princeton, on Route 206, right by the Princeton Airport. Across the street from Honda dealership, there is a little medical condominium plaza, Montgomery Commons. I'm located right in there, building number 8. It's the Princeton Spine Disc Chiropractic. Address is 815 Executive Drive, building number 8, Princeton, New Jersey, 08540. That's the address. Pretty easy to find if you are familiar with the area. Well, thank you, Mark, for having me on this.